Yes, we're through with those. Apparently, I've been told by the board clerk that the social media is reporting that somehow we moderated some of those messages. We had 92 recorded messages. We played every single one of them. If there was any cutoff, it was because they exceeded their 3 minutes. We didn't cut them off. The system is set up to allow for a 3-minute message. So we did not moderate any of them. We didn't make any changes to any of them. You heard them just the way they came into the district today. There was 92 of them, and you heard every single one of them. Mr. Superintendent, if you want to take over with the workshop.
Yeah, thank you, Mr. Chairman. Mr. Clausen, I'll turn it over to you. Thank you.
Thank you, Dr. Fenoy. I'll be presenting my screen now. Okay, hopefully everyone can see the screen. We see
Looks
the
like
screen?
Yep, I think everybody can. If anybody can't,
Okay, thank you. First of all, good afternoon, good evening, Chairman Barbieri, school board members, and Superintendent Fenoy. Thank you for the opportunity to share with you the work of the Reopening Task Force. Before we begin, I would like to thank all the members of the task force as well as the staff who have contributed to this important project. Today, we'll be covering our overview of our work, our guidance and research, stakeholder engagement, and considerations for next steps. Throughout this project, our guiding principles have been to ensure that we protect students, staff, community in regards to health and safety, provide a world-class education with excellence and equity, foster student emotional health and well-being, and ensure equity for our vulnerable and underrepresented populations. This timeline highlights the key milestones of the Reopening Task Force and our accomplishments. On June 10th, we had the opportunity to present our preliminary work at the board workshop. Today, we will be reviewing reopening models with the objective to give you information on the best reopening options for our district, which will be announced on July 15th. I'd like to just take a second to walk you through what the work that has been done since the Reopening Task Force was formed. Over 5 weeks ago, we worked to organize 7 teams comprised of our district divisions, as well as elementary, middle, and high school groups led by instructional superintendents who worked in collaboration with principals and teachers. This presentation includes input from our subgroups, our latest guidance from key research, results of parents and employee survey, and legal guidance from our district's attorneys and considerations from our executive cabinet. Many local and national resources were utilized as we looked at implications and considerations of the 3 options. The traditional model of bringing students back to school, this option permits all students the opportunity to return to the building 5 days a week. The blended model, which would allow some students to be working on campus and others to be distance learning. For the distance learning model, board members, as you just heard Mr. Katz say, this is a new and improved version of online learning. The district has gathered feedback from parents, students, teachers, and administrators in order to craft new expectations for distance learning in the fall. This 2.0 version will provide students with daily live instruction as well as small group and individualized activities. In this slide, we reference considerations from the governor's plan for Florida's recovery, the CDC, and the McKinsey guidelines. In the governor's plan for Florida's recovery, we look at the possibility of aligning each of the phases of reopening to our 3 options of opening schools. And in the CDC guidelines and the McKinsey report, there are very specific strategies for each of the reopening options. In an upcoming slide, we'll be taking a more detailed look at the CDC guidelines.
Mr. Clausen, Mrs. McQuinn has a question.
Yes. Go ahead, Ms. McQuinn.
Okay. Hi, Mr. Clausen.
Hello.
Let me point out to the public that Mr. Clausen has been an incredible principal at Palm Beach Gardens High School, and we all know how I feel about that school. Now, I held off on this question/comment during the budget workshop when Dr. Robinson was referencing our students who don't have the web connectivity, etc. I chose to wait until now, and it may be coming, but I didn't see it when I read through the slides, so I'm going to ask it now. We know that we have students, I can't remember the actual number / percentage, that simply didn't check in, or they checked in once or twice in the spring. What is our plan? And please be specific with me. What is our plan for physically being in touch with every student that we realize this doesn't count kindergarten, that we were not able to engage in the spring? And I mean this, I'm not, you know, I say some ridiculous things sometimes. If it means that I take a neighborhood and go to their houses, I will. I just want to know we have a plan. Please let's not start on the 10th knowing that we're going to miss some students. Thank you.
Yes, ma'am. Mr. Oswald, if you could please respond to that. He and his team, Mark Howard, they've been working on that, so he can respond to that at this time.
Yeah, thank you, Dr. Fenoy, and thank you, Ms. McQuinn, for that question. Since we closed school last year, we have been collecting data, as you know, and we've been tracking the number of students who've had limited engagement. And for those students who engaged 2 or less times per week, schools received a roster based on that. Based off that roster, every school ranked those particular students as to the reasons why they were not signing in. So they did phone calls, welfare checks, etc., to see what those issues were. So when we roll into the new version and moving forward in the future, that data will be used by each schools to rank the priority list based off of student achievement. So it's with a lens of equity of who gets devices and who we work to ensure that if Wi-Fi, for example, we knew that internet access was one of the major reasons for some families not to sign in on a regular basis. So they will be a priority moving forward to ensure that they have access to internet. So each school has that list. We've ranked ordered them, and they've been filling in that data.
Okay, so follow up, Mr. Barbieri. So on August 10th, we will, again, I'm not going to count kindergarten, even though I want to. On August 10th, we will have contacted every student that was on that priority list.
Yes, all schools have already completed that. They went through that basically the whole month of May. They were working on finding out those reasons as to why, so that we had that information to problem solve for moving forward. I think you're still muted, Ms. McQuinn.
Ms. McQuinn,
sorry.
there seems to be a delay.
Yeah.
Go ahead.
Okay, I unmute. No, that was my fault. Whatever I did, I muted myself again. I said you know that I will follow up with this in the following week, because I understand why we had unengaged students in the spring, but even in terms of accountability to the Department of Education, we're not going to be able to say that we had a prioritized list. We're going to need to show them that we've engaged every single kid. So thank you for listening.
Absolutely, and I'll show you those lists and how we rank those.
Before I call Mrs. Andrews, I have a question for you, Mr. Oswald. And I talked to you and Dr. Sheffield about this morning. So, you know, just as all of us had training when we first started these meetings, these Google Meet meetings, we all had practice. Some of the teachers have requested that they get an email list. They get a list of all of their students and their email addresses and their phone numbers before the 10th, so that they can contact every one of their students and make sure that those kids can practice getting on with the teacher. We need to make sure that that happens, because that way we will also find out if there's children out there that don't have devices, don't have Wi-Fi, have spotty Wi-Fi. So that's imperative. If we're going to start the distance learning on the 10th, if we can do it that quickly, then we need to make sure that these teachers have these lists ahead of time. There's no reason why, we should wait until the 10th to figure out, that some of these kids don't understand exactly how to get on, or there's nobody there to help them. We need to do that ahead of time so that the kids are ready the first day of school to start learning. So can you just cover how you're going to make sure that happens?
Yeah, so any current student in Palm Beach County, they already have an email address as well as the families. So that will not be an issue to make sure that all teachers have that information. Contacting students prior will be a priority to reassess that data that I was just speaking to of who is still in need of devices, who is still in need of internet. One of the challenges we would have to get to for the distance learning piece will be a number of families signed up for the Comcast deal that ended on June 30th. So based off that, we're going to have to reassess those parents and those families who may need additional support. Mr. Burke talked to that earlier. We're working on a couple of different options. We're hoping in one of the couple of municipalities that on the infrastructure around pushing kind of Wi-Fi into certain communities, that we'll have a couple of those communities ready by the start of school as well. So as far as getting the email addresses and phone numbers, yes, that will be all part of the preschool work.
All right, thank you. Mrs. Andrews, you're next, and then Ms. Brill.
Thank you. And I was going to ask this at the end, but can you go back to the timeline, reopening calendar timeline, please? I just want to know about the final reopening decisions communicated, and maybe Dr. Fennoy will help with this piece, because as I look through this and as I spoke to Dr. Fennoy and his team the other day, I just want to know, I've asked some deep questions about how it's going to work once decisions are made by this school board, but we haven't dug deep enough in here about choices for parents and how school will look and what it's going to look like for distance learning, blended learning, virtual learning, and the whole work. Some of this is not in here. So next week is a big week for us as a school board, and it says final reopening decisions communicated. Is that something, a packet that we're going to get, or will we be talking at the board based on some additional information on questions that have been asked by a board member just this week, me, or what's going to happen on next week? Or is it just the superintendent's going to say to us, this is his recommendation, and we're going back to work on how it's truly going to look if the board approves it? Can somebody help me with that?
Yes, ma'am. Our rules, after we get the feedback from the board today, the team and I will convene in the morning and we will be making that final recommendation. Obviously, there are rules that have to be posted at a certain time so that it become an agenda item so the board can ultimately vote on that next week. Now, in the meantime, we were literally just on a call at 4 o'clock with the state. So things are they're still calling us to meetings every single day. So at that time, I hope we have clarity from the state. And then if the board approves the recommendation that we bring forward, then we will start working intimately on that narrow focus. Yes, ma'am.
Okay.
Ms. Brill, and then Ms. McQuinn.
Thank you. So I just wanted to piggyback on what Mr. Oswald was saying about contacting the parents and finding out if they have devices in their home. At that time, Mr. Oswald, is it possible for us to find out if there are multiple students that are going to be online in the household and their parents online? This is going back to my comment in the budget workshop about bandwidth or speed, or however you want to say it, to make sure that students that go online will have the ability, if they do have internet, to stay online and be able to learn. Because my understanding is some families with 3 and 4 children, people are being knocked off the internet. So I think it's a great time when you're finding out about devices, find out, do they have problems all being online at the same time? And then we know who to target if we're going to ask for help in that regard.
Yes, absolutely. I heard you earlier, and we'll add that piece to our checklist, working with the regionals instructionals with the principals.
Ms. Brill, your microphone's off. Ms. Brill, your microphone's off.
That's because I'm done. I was just nodding in agreement. Thank you.
Okay, and now I'm on. I just received a text from a very reliable source that Comcast is extended until the end of 2020.
So for clarification on that, what they've extended is the initial online, the signage to sign on for that Comcast for the free 2 months. So free 2 months. They have not extended anyone who signed up for the free Wi-Fi through June. That, for those existing customers, that's not being extended. What it is being extended is for new customers. So, and I'll check with Mark Howard on that while we're talking, but we had a long discussion on that because when I saw the initial press release about Comcast and that extension, you had to kind of read the fine print under there because it was a little confusing.
Okay, well, I know that you will clarify that because, of course, my phone's busting up here. And I do have something else, but I'll save it. Thank you.
Okay.
Thank you, Mrs. McQuinn. I don't know about the rest of you, but I've got a definite delay here. So board members look like they're still talking, but there's nothing coming out. So I think Mrs. Andrews was next.
Thank you, and maybe this has been answered. When we have some families that have a lot of children or a lot of people on the internet, and I think we've been talking about how the service is slow, is there any way that Comcast is going to work with those families? Many of them said that their cable bill went up and they weren't able to keep up with the process of being able to be online because of just the usage of the internet. So has anybody looked at that with some of our families?
So we're in constant communication with Comcast, so we'll check with them, Ms. Andrews. And I know Mr. Howard has joined us. Mr. Howard, is there anything you want to add on that piece or regarding the comment regarding the Comcast deal?
Mr. Oswald, you did state it correctly. Their free COVID offer is the first 2 months free, and it's only for new customers. So what they've extended is to any new customers who sign up for Internet Essentials. They get the first 60 days free and then they pay. In terms of their speeds, they did open up the speed some, but it still has a limit, I believe, of 50 megs. It's another thing that we have advocated for with Comcast, and we will continue to do so.
All right, Dr. Robinson?
Thank you. I have a lot of questions, but I'm going to respectfully request that we hold our questions to the end and maybe make our notations about what page we want to go back to with our questions, because I think some of our questions might get answered later on, but I would just like to get through this critical presentation.
It's up to the other board members. If they raise their hands, I'm going to call on them. Guess you can move on, Mr. Clausen. Mr. Clausen? Can anybody hear me?
Yes, sir, I can hear you.
Okay.
He's probably frozen. Let me see if I can text him.
He's muted, Dr. Fenoy.
Larry, are you muted? I see you manipulating it.
Mrs. McQuinn, did you have something you want to add?
Well, just while we're waiting for Mr. Clausen, if he's back, I'll wait. Okay, I'll quick ask it. For those students who have the laptop this is from a teacher, who has a laptop without a camera, can they trade it in for one with a camera? And you can wait and answer me later. I'm off.
Yes, we're working to make sure that everyone has a camera. That's on our list. And that's what was on the survey as well.
I'm sorry, let me go back in. Something happened. Hey.
Let's see. Let's see if we can hear.
I'm not presenting though.
Oh, you're. Okay. Let's see. Let's see if we can hear. Oh, you're. Okay. Let's see if we can hear. Oh, you're. Okay. Let's see if we can hear. Oh, you're. Okay. Let's see if we can hear. Oh, you're. Okay. Let's see if we can hear. Oh, you're. Okay. Let's see if we can hear. Oh, you're. Okay. Let's see if we can hear. Oh, you're. Okay. Let's see if we can hear. Oh, you're. Okay. Let's see if we can hear. Oh, you're. Okay. Let's see if we can hear. Oh, you're. Okay. Let's see if we can hear. Oh, you're. Okay. Let's see if we can hear. Oh, you're. Okay. Let's see if we can hear. Oh, you're. Okay. Let's see if we can hear. Oh, you're. Okay. Let's see if we can hear. Oh, you're. Okay. Let's see if we can hear. Oh, you're. Okay. Let's see if we can hear. Oh, you're. Okay. Let's see if we can hear. Oh, you're. Okay. Let's see if we can hear. Oh, you're. Okay. Let's see if we can hear. Oh, you're. Okay. Let's see if we can hear. Oh, you're. Okay. Let's see if we can hear. Oh, you're. Okay. Let's
Mr. Barbieri, while we're waiting, I just wanted to say I'm ready to pay for a better service. I'll put my name out there as one that would be willing.
See. Okay, hopefully I'm back up and running. Can you guys see it and hear me?
Yes.
I'm sorry for the technical difficulties. Let me get to the slide that we left off on, and we'll try to move through this very quickly. Okay. Taking a closer look at the governor's plan for Florida recovery, it states, if COVID-19 data suggests an increased spread, the state should remain in the current phase. Currently, Palm Beach County, Broward, and Miami-Dade are in phase 1. And as we are aware, the number of cases are increasing all over the state. In this slide, we're analyzing some of the key CDC guidelines under each model and the challenges adhering to those guidelines.
Mr. Clausen, let me ask a question on that last slide.
Yes.
Mr. Superintendent, it indicated that Miami-Dade, Broward, and Palm Beach are all in phase 1, but some of the callers today that we just listened to said that Miami-Dade and Broward are offering options to parents other than just distance learning. So my understanding is that they're not offering any options. Can you just advise us on what the position is that, as far as you know, with respect to your two counterparts, the superintendents in Miami-Dade and Broward?
Yes, I think what a lot of the speakers are speaking to is what we're doing today. I think as Ms. Andrews said before, they did this weeks earlier as the options available that they were considering. However, both superintendents have both made statements since Monday indicating that in phase 1, then the only option available to them would be distance learning. And so none of the boards have accepted fully the return options because we now have to change everything. So those options were presented earlier, but now since they're both in phase 1, they're considering the same options that we are.
Thank you.
Okay, again, this slide, we're looking at CDC guidelines and under each of the challenges under each of the models. As you take a minute to review these guidelines, let me remind you that the CDC guidelines are not binding, but are recommendations for promoting a safe and preventive reopening environment. The list is not inclusive of all guidelines. And it's also important to remember that challenges are also based on operational and financial considerations. But as you take a look at this slide, the key takeaway from the slide is that many of the CDC guidelines are less challenging under the distance learning model. However, there are a few guidelines that are more attainable under the traditional model. Many parents have sent the American Academy of Pediatrics guidance to school board members and district staff. The RTF felt that it was necessary to acknowledge this guidance as part of our presentation today. This article recommends guidelines for children of varying age groups to return to school, optimizing physical social distancing and the appropriateness implementing of these guidelines. The guidelines do note that adult school staff are more at risk compared to young children and need to be able to distance from other adults as much as possible. So there should be no in-person faculty meetings or no class visitors. And the article emphasizes the need to make accommodations for students who are medically fragile or have special healthcare needs or disabilities. However, these guidelines do not necessarily address the health concerns raised by school-based staff and their willingness to physically return to school in order to contribute to daily school operations. Lastly, from this research, it's important to note that social distancing cannot be maintained. Students and staff can wear facial masks. On June 11th, the Florida Department of Education released guidelines for school reopenings. And in that document, they recommended taking a dimmer switch approach rather than flip the light switch approach to reopening. The document also noted that schools are inherently designed for social interaction, not social distancing. Let me emphasize that this document is not a set of mandates or final considerations. Instead, they stress reopening must ultimately be driven by local data and the goals of restoring optimal conditions for learning. Once again, reopening is seen as a locally driven decision. A new Florida Department of Education executive order was released this week on Monday, July 6th. 2 webinars have been hosted by the Florida Department of Education since to help districts and charter school governing boards understand the implications. District leadership is working closely with the state and our lobbyists to clarify outstanding questions and ensure that these new FDOE requirements are incorporated into final reopening plans. Again, more information will be shared by Dr. Fenoy and senior leaders next week as part of the communication of the final reopening plans on July 15th. In this slide, we're looking at equity considerations within each scenario. I think we can all agree that students' needs are less challenging when students are in meeting students' needs are less challenging when students are in school in the traditional model. However, there are a few areas where distance model is more beneficial. On this slide, we look at decision frameworks. With an emphasis on reopening is not about when we return, but how we return. On the left, you'll see the stoplight configuration with the 3 models. And on the right, a list of constraints and guardrails. And in the middle, our objective is to reopen schools, keeping in mind safety, equity, flexibility, and effectiveness. And in the bottom left, you can see that parents would have the choice to default to distance learning at any time. Ultimately, this framework is about how we would move between different reopening options and scenarios. The next few slides, we'll be looking at stakeholder engagement. In June, we conducted our parent and guardian survey and had over 66,000 responses. We conducted our staff survey, which included all employee groups and had over 16,000 responses. Then 10 town hall virtual meetings were held by geographical region. In addition, the superintendent and his staff have met with the Health Advisory Committee, principals, leaders of the Business Development Board, the Economic Council, elected officials, CTA, and other labor unions. A quick reminder on the survey results. Feedback from parents, guardians, school district employees, and other community members will help inform the final reopening plans, but the district's decision to reopen schools safely will also take into account recommendations from the health and medical professionals. It's also important to remember that all the survey data was collected prior to the current spikes in COVID-19. So it's reasonable to expect that many changes may have happened since the current increase in cases. This is a slide from the parent and guardian survey. This survey information was shared with you last week. And again, the key takeaways are that more than one reopening option should be considered. Also, the employee survey results were shared with you last week, and the key takeaway is that job function dictates preference for which option was selected. In the next several slides, we'll be looking at academic and operational focal points, keeping in mind our guiding principles. This slide identifies recommendations and considerations in 3 different models. Key points mentioned are daily attendance, standard-based curriculum and assessment, social emotional learning, student engagement, classroom and virtual interventions, virtual professional development, and a focus on adhering to ESE 504 and ELL plans in school and virtually, plus supporting our lower performing students. Here we are taking a close look at recommendations and considerations for transportation. Under the the blended and traditional models, many of the same recommendations should be considered. Students and staff wear masks. Students must register for bus transportation. Additional time will be needed for cleaning protocols, developing an at-risk employee plan, and the possibility of job requirement changes. For the distance model, staff who are reporting to work must wear masks, and we may be looking at partial staff reallocation and the potential for furloughs and the risk of losing certified and licensed employees. Like transportation, we need to review some important recommendations and considerations for school food service. The first 4 points are the same under the traditional and blended models. Students travel to the cafeteria to pick up food. The food can be consumed in the cafeteria, in common areas, or in the classrooms. Students will be social distancing and wearing masks while in lines waiting for their food. There may be a need to enhance lunch schedules. And for the blended and distance models, out-of-school feeding programs will continue if approved by the USDA. For health and safety, many key recommendations and considerations are the same for the traditional and blended models. Clean and stock restrooms on an increased rotation. Teachers assist with cleaning frequently touched areas between classes. Monthly protocol inspections. Clear sanitizing and remediation protocols. And continued school police support on every campus every day. And in anticipation of increased health adjustment behaviors. Under the distance model, there's the potential for staff reallocation, and maintenance and plant operation will continue to maintain our buildings. The next two slides, we look at financial impact of COVID-19. Technology demands include 82,000 new student computer devices. Additional PPE and custodial supplies and equipment will be needed depending on which instructional model is selected. Funding sources that may be utilized to meet these needs will be from the capital budget, the reserve, and from federal funds from FEMA and the CARES Act grant. Other considerations needed to be mentioned are for school food service, a decline in revenue due to limited meal service opportunities, and the potential cost increase associated with meal packaging and delivery. Given the budget outlook, it is very important that our plans retain full student FTE revenue and leverage existing workforce as needed to meet the new demands. While looking at purchases for the upcoming school year, there are a few key issues that we would like to bring to your attention. The additional 82,000 computers will achieve the 1-to-1 student device ratio. However, due to high demands and disruption to the supply chain, the current ETA for the new devices is September, October of this year. Disposable and cloth facial coverings and clear face shields are being purchased, and the Florida Department of Energy Management will be providing 360,000 cloth face coverings for staff to the district. A portion of those will need to be provided to charter schools. Also, all PPE purchases will be included in the district's FEMA claim for reimbursement. The warehouse and schools are well stocked with hand soap, paper towels, toilet tissue, and cleaning supplies. Transparent sneeze guards partitions have been purchased for selected public school offices, for example, main offices, guidance offices, student services. At this time, the staff is working through procurement challenges caused by high demand for the purchase of electrostatic sprayers and disinfectant. Additional contract services may be needed to supplement our district custodians and to respond to COVID-19 outbreaks. And finally, from purchasing, appropriate signage will be made and or purchased to help with social distancing, student traffic flow, hand washing, and other important information. There are legal considerations that must be addressed under each of the models. Under all three models, bargaining consideration must be addressed with all affected labor groups. Under the traditional and blended models, we must consider limiting visitors on campus. And under the blended and distance model, we must look at potential district liability for off-campus activities during school hours. We must address the continuity of services and accommodations for ESE and ELL and our lowest performing students. And we must get a waiver for the National School Feeding Program. Other key considerations from our legal team are that the interim employee reporting to work protocols policy 3.82 expires on September 8th of this year. The superintendent will be recommending an updated policy by July 22nd. And lastly, from legal, we must address considerations for employees who do not follow protocols. The next 4 slides will be addressing barriers on the 3 models, including potential risk as well as potential mitigation efforts. Under the traditional learning model, the transportation department may be looking at a potential risk of having a driver shortage, or if we need to purchase more buses, there's a very long lead time on those purchases. And at this time, there's no potential mitigation. There's the lack of space to adequately implement 6 feet social distancing recommendations on buses, and the potential mitigation would be to pre-register to better anticipate the number of students per bus and have students and drivers wear masks. For the blended learning model, transportation would need 4 to 6 weeks to appropriately schedule bus routes for students. A potential mitigation would be to start the school year in distance learning, delay the start date, or plan for a staggered reopening. There's the potential for a reduction in certified and licensed staff. A potential mitigation would be to reallocate some staff to assist in other areas. The out-of-school feeding program that has not yet been approved by the USDA. However, the application has been submitted to extend the deadline. Also, the Department of Education currently will only fund face-to-face VPK instruction. We continue to work with our lobbyists and to explore options for VPK if Palm Beach County remains in phase 1. For distance learning, the risk of losing operational capacity in transportation, school food service, and custodians for a potentially long period of time. The potential solution would be to reallocate staff to assist in other areas to the extent possible, and potential furlough for remaining staff until operation resumes. With the concern of losing capacity, restarting operations in the future may become problematic. And like the blended model, we have the same risk where out-of-school feeding program needs to be approved and the VPK issue. Additional barriers for all models. The risk of a less than full adoption of protocols with the mitigation of training, signage, and a district-wide safety culture. A potential reduction in FTE based on attendance. At this time, we have no mitigation or no potential mitigation. And finally, a potential gap in salaries for staff for the FY21 school year if the start date is delayed. The potential mitigation would be to start the school year in distance learning. This is the timeline for the remainder of the summer. Today is July 8th, and the task force is presenting their detailed reopening options. July 15th, a final decision will be made. July 16th, all hands on deck will be in place to start implementation of that plan. And hopefully in August, the new normal will start school for the FY21 school year. We'd like to thank the communications department. They have created a page on our district website for our reopening of schools to help keep our parents, students, and community informed. And lastly, School District of Palm Beach County Reopening Task Force, planning for the safe return to schools and welcoming our students and staff back in the most appropriate and safe way possible has been our #1 priority. Thank you, and now we can take the questions.
Board members, Mr. Andrews, then Mrs. Whitfield.
If we go back to page 12,
Okay.
I wanted to know why wasn't there a choice for virtual learning? We have a Palm Beach County virtual learning program, a Florida virtual learning, So why is that not an option for parents?
That has been and always, that is an option for parents that they can still use. That doesn't impact our going back to school. They can use that at any time that they want, before or now. So that option is still available to all parents.
Okay, just make sure it's, people know that. Thank you.
Ms. Whitfield?
Thank you so much. Really quick before I make a couple of questions, I wanted to say a huge thank you to CTA and to Mr. Katz and to all of our staff that are working with them. One of the struggles that I feel like we had in the spring, or that I watched my daughter struggle with a lot, is really that spending time with her friends and being able to have that motivation to be online. And I know that everyone is working so hard to really make sure that we have that in-person feeling through virtual learning. So I know that that is something that everyone is really trying for. And I just want to say how much I appreciate it, because I think if we do end up going back virtually, the key to making it work is really the face-to-face time with all the teachers. And I really am thrilled that that is something that that my daughter got to experience so much this past year. And I heard from so many people who didn't have that. And so as difficult as it is, that's something I'm really thrilled about. So I just wanted to say that. The question I had is about the blended option, where you talked about VPK and the food issues. One of the concerns that I have if we go back completely virtual is that the state is not interested in supporting us in that. And if they are not interested in supporting us, what are the chances that we're going to be able to get the food issue taken care of? Because that's very, very important to me, that, people are able to eat, because we feed kids sometimes 3 times a day. So that's huge. And then the second thing is about the VPK, obviously a huge concern for me as well. Having kids go back only in a face-to-face model for VPK, if that's if we're only doing virtual and then we have to send those kids back. So I guess the questions I have are really like, what are the chances that the state is going to approve this? What kind of conversations are going on? Did anything happen in that recent call that was at 4:00 that we weren't able to hear? That's what I'm concerned about. Thanks.
Ms. Whitfield, in regards to VPK, the state did indicate on yesterday that they will be talking about at a later date as it pertains to the instructional model for VPK. At this time, they are indeed saying that VPK must be provided through brick and mortar, but they are discussing in regards to what will be district's options.
Okay, Ms. Brill, then Mr. Shaw, and then Mrs. Andrews.
I was going to get an answer from Ms. Monblow, maybe on the food situation first, Mr. Barbieri.
Yes, go ahead. Sure.
Thank you. Yes, so the USDA just did approve the distance learning model and the grab and go. What we are still waiting for is to see if there's an opportunity to sort of serve into neighborhoods off buses. So we do have the capability, if we are doing distance learning, to have the parents come to the schools. At the moment, we have to have them come to their assigned school, their brick and mortar school, and not necessarily the nearest school, which I wish they would do. So we're still working with them on that. And we also have to attach every meal to the child. So we would have to have student IDs, and as opposed to what we're doing right now, where it's just sort of they come and grab and go. There are some logistics to work out there, but at least we do have approval through this year to do the grab and go model for distance learning. If they are virtual school, we do not have that capability, though. There is a difference there.
Thank you for working on that.
Ms. Brill?
Thank you. So I do have a question. I am going to make a comment, though, first. And my question may be premature, so I hope that Mr. Burke is not going to be too upset. But I want to start off by putting my position right out there. I do not believe we can safely open brick and mortar schools fully on August 10th. We have to open virtually with distance learning at that time. And based upon Dr. Fenoy's comments, we have the required local health directive to proceed on August 10th virtually. So the discussion that we need to begin as soon as possible after we announce formally our decision, assuming that we do stay with distance learning fully, is what are the metrics to be used to determine when it will be safe to reopen. And concurrent with that, the discussion has to be, how do we phase back in our students? And what will our classrooms look like? The deadline, if I understand the presentation correctly, and from what we've gotten from the Department of Education, is the deadline to submit our plan is July 31st. So we really need to get cracking on that. My question, though, may be premature, but it impacts a huge number of our employees and our workforce. And that is, if we move to 100% distance learning on August 10th, which is what I hope we do, how long will we be able to continue paying all employees, and how will we inform them? Additionally, I just need to put out there that I emphatically want us to continue healthcare benefits for all of our employees if we later need to furlough staff temporarily. But my question is, because for people watching who are in positions that will be greatly impacted if we go to distance learning, how long can we continue paying them, and how will they be informed?
Mr. Burke?
Yes, good evening. That's a complicated question that we are busily researching. We're in a unique situation. We know we finished the school year and we had the governor and the commissioner of education implore us to maintain our employees and keep them on board. And we were able to do that for our full-time staff. The executive order that came out this week by the governor and commissioner gives me a little hope. There was language about maintaining our funding. The October FTE survey basically determines our funding for half the school year, the first semester. And there's language in there that we'd kind of be held harmless on our FTE. And that would apply to both student FTE and transportation FTE. So that gives me a little hope that there's a possibility that we could retain our staff. Normally, there is a statute that we're not allowed to pay employees before they start working for us, before the services are rendered. So those two issues are kind of at odds. The other dynamic is we have the Federal CARES Act money, and part of that grant application also kind of implores school districts to maintain their employees, keep them on the payroll to the extent possible. So I really, I've had some initial discussions with Ms. Rico and her team. I think I need to kind of do a little more homework and get back to the board before you're asked to take a vote on July 15th. That's such a critical, important issue. I don't want to answer it here without doing our full due diligence. I realize that lives hang in the balance, and we really need to think that through and make sure we're on solid ground, and that the board, that we give you your options and let you know what's possible. I think, from the conversations I've had with the board, it seems apparent to me that that's the board members' wish, that if there's a way to do that and try to keep people, on our payroll and out of the unemployment line, that's what we should be working towards. If it's not possible to pay people their salaries, the issue of maintaining their health insurance, I think is something that could certainly be accomplished. I've seen other agencies do that recently. And we could talk about how long that's possible. And hopefully we could at least span the gap until we reopen fully. So I understand I'm not giving you a solid answer there, Ms. Brill, but we are working on that, and we will get back to the board as soon as possible with a definitive answer.
Mr. Shaw?
Thank you very much. I've got several different things. I'll probably save my comments for later, but some questions. One of the questions is there a possibility that if we do virtual full-time, are there any options that have been considered for dealing with our special education students, of maybe some direct services that can be provided to those students even at home, or what options are there? Because we have a lot of people who might be available. If students, for example, physical therapy occupational therapy, speech therapy? Are there any options there? And also related to the timing issue, I would like to see us have, and obviously this would be a very fluid target, but have a targeted calendar of what the critical times would be that we would revisit the issue of when we could open school. Not that it's going to be something that we could rely on, but so that it's an active activity on the part of staff, that if we open on August 10th, on August 30th, what do we expect to have happened in order to move closer to going back to school? September 15th, whatever that looks like, I'd like to see a real run of show set for that plan of moving back into the classrooms when we could. I'll go ahead and make some of my comments on this. I support Mrs. Brill's position that she had. I think that the reality is that we don't have a lot of options now, but to look at virtual. And there are a couple items that I think are absolutely critical to this, that I would not support anything unless the first one is, I think our teachers need to be back in the classrooms to do virtual education from their classroom for several reasons. The continuity of instruction, it puts teachers in a position to be in their classroom where social distancing and protective things could be dealt with. We can handle specific situations with teachers. It also gives the teachers access to all of their materials and supplies and technology that they need to be able to provide that instruction. I believe that the schedule, and I've seen a little bit of the schedules of what a daily schedule would look like, but I do believe that the expectation from us should be that students are engaged all day long, a regular school day, and not just for a couple hours a day, and not after school in the evenings, and having some real fidelity to the instruction that we need. I also think that we can take a look at how we can creatively look at some of our other employees who are instructional employees. What can we do to benefit the social emotional health of our students by using our counselors and other employees around the district that can be of assistance? If our school police officers are in a position where we don't need them on campus all the time, is it possible we could use them to be involved in some of the social emotional health issues of students and give assistance there? The hotspot issue, I think that is bigger than the district. I don't think we have complete control of the hotspots. I've talked with several different cities, and one in particular is working very closely with their community to try to get the hotspots and access. But most of these that I'm aware of, a good number of them are in county pockets, and that's something that we're going to have support from the county commission on. I have a real concern about, if I were a parent of a kindergartner walking into school on whatever day it is, how do you teach a kindergartner the basics of reading online? And that's something that I don't expect an answer to today. But I really think that that's an instructional issue that we need to have a lot of understanding about, and some real clear expectations of the continuity that would go with providing that instruction. And I guess the other one is just the accountability that we have for everybody, so that if we're paying people, there is some type of productive activity that we can hopefully provide to them, so that they don't lose interest in what we're doing and they're just sitting at home with nothing to do, if we have ways to work with them. So I think that covers most of mine at this point. Thanks.
But Dr. Fenoy.
Yes, I would like to say to the board, if next week if the recommendation is to go full distance, and the board accepts that recommendation, then I will commit at this time to creating that timeline. I think it's also important for the board to understand that at our last Health Advisory Committee, I did ask that committee, they asked me to come back after the board votes on the 15th in July to begin working with the health department and others about metrics and helping me create that timeline. That was really one of the first questions I had, is if we went that route, what would be the number of weeks to go by before we start assessing? And then I'm going to charge, based on what the board guides us on, to the academic team to start thinking about who phases in first and really start having a robust discussion around that. So I will commit to that timeline similar to what we did for this process. Yes, sir.
Mrs. Andrews, then Dr. Robinson.
And thank you. And as I said a week or so ago, that definitely with the health and safety issues that we're dealing with right now, and it's getting worse by the day, that the only thing we can do is a distance learning model, very clearly. When I look at all of the pieces of the blended and going back to school 5 days, the report coming from the Education Commissioner and the Governor, there's no way that we could ever do that here in Palm Beach County, not even with a blended model. So much discussion needs to be had with the board, as well as the stakeholders, the parents, the employees, on how you can even put together a blended model. My question the other day to the team, the task force team, is we're not even ready to put people on a bus to get them to school. Many of our children are bused. When we start thinking about spacing and accommodations of getting people back in school, we're talking about a plan that has to be into the state by July 31st. I mean, that's why I asked about the calendar early on. We are really late in doing any of these things that the state has asked us to do, but we have to put the efforts in to do it. But in order to keep people safe, not just the children, but the employees, the teachers, everybody, the bus drivers, the custodians, all of the people that need to come back to work, they can't come because we're truly not ready. We're not ready from a health standpoint, and we're not ready from the standpoint of even planning so that parents will want to bring their children back. Most of the parents that call me, they want to know the deep down issues of what happens if we have a blended model. Will elementary children start first? And then would you go on to secondary? And how is the spacing? Are our schools ready for 6 feet apart? Those kinds of pieces. Coming back and forth from lunch and the playground, how are we going to sanitize the buildings? It's so much stuff that needs to be talked about and worked through to even get to the blended model, to even say we're going to bring anybody in a building. But we know we can't bring anybody back anywhere right now when we're at a point where we're at historic highs on the infection of the COVID-19 here in Palm Beach County and across the state of Florida. So I keep saying, I want to see a plan. I mean, we have a plan manual for hurricanes. I mean, we kind of can utilize it and change it periodically based on our needs from year to year. But right now, we've kind of read through these PowerPoints over the last few weeks, but we've got to delve deeply into how we reopen. Even as we look at how we do distance learning 2.0 now, which is going to be better than what we had before, but that's the best we can do based on the time that we have. I don't want any employees to be laid off or not get paid or lose their jobs. That's why I was asking the questions earlier about the budget and the HEROES Act, where we do have some money. If the Congress and the Senate and everybody gets together, that's $1.5 trillion of money that we can have. 58 billion is going to education. That's a lot of money. So, I mean, that could happen this summer because, you know, the Senate and the Congress, many of them have been on vacation, but they're coming back. We have to talk to our legislators to let them know we need to get them to pass that HEROES Act because guess what? Money for the cities, but a lot in that act for schools. And we're going to need a lot of money to be able to do the things that need to be done to keep the children safe, to keep our employees safe, and just to keep it so that when people do come back, we can focus on educating them. But right now, I don't see any time soon that Palm Beach County, Broward, or Miami-Dade, any of us are going to be able to bring students in brick and mortar anytime soon. And so the governor and the Commissioner of Education need to understand this. We have a lot of experts out there talking now that it would be insane to say you're going to put children back in brick and mortar without having the precautions necessary to keep them safe. so that they can become spreaders and go back home and then kill somebody or have somebody sick, or they may get sick. So we're not ready, but as a school district, I do appreciate the task force. You got a lot of work to do, and we as a board have a lot of work to do to listen to all the different pieces for us to move to the next levels. And it's going to take some time. But as I looked at the emergency order, it said all of August, but I don't think we're going to be ready to do anything in the month of August. It's going to take us a while to get there. But the planning should continue. The planning, the metrics, all the things that we need to do, the blended model, to get to where we need to return soon. We need to keep talking about that and letting parents have input as we look at our health conditions. And as everybody knows where we are, because we're living it every day, we need to make sure we have input. Thank you.
Thank you. Thank you, Ms. Andrews. The order that I have speakers lined up are Dr. Robinson, Ms. McQuinn, Ms. Whitfield, and Ms. Brill. Dr. Robinson, you're next.
Okay, thank you. So first, I want to respond to some of the comments that were made. And then later, I want to read my prepared words. So Mr. Barbieri, put me again on the end of the current list you have, please. So first, I want to thank staff for that thoughtful presentation. And Mr. Clausen, I don't know how how they pushed you out front like that. I hope you had on bulletproof vests, but it's very good. I think it was thoughtful, and I appreciate the pros and the cons. I think, I can push back on anything, but I won't bother at this point because I see the time and the thought that was put into this. And I just want you to know that I truly appreciate everybody who participated in what apparently was 25 million meetings to get to that point. So thank you for that. But I want to say that I'm also really pleased. So since I've been on the school board 20 years, I was on this board at a time when it seemed to me, it felt like the board didn't really care about its employees. Like they cared more about the bottom line. Like they saw it as a business venture instead of something where we develop young people into their full potential, right? And so, and also acknowledging that we're the largest employer in Palm Beach County. So I want to say, I can't even remember who asked the question at this point to Mr. Burke, but I want to answer from legal about how can we pay staff? Because I still don't want to contribute to the unemployment rates. I am hopeful, I am prayerful that we will see the light at the end of the tunnel, and that there will be a time in the foreseeable future where we will go back to something close to normal in terms of everybody working in the job that they were hired to do, right? So I'm stating I want to pay people as well. I think Mrs. Andrews said it well. And so I don't want to answer for Mr. Burke. I appreciate his answer about the budget considerations, but I want legal to tell us how we can do it. How about that? I think Mr. Shaw's comment about OT and PT and so forth at home is very interesting to explore. And then, but the comment about teachers going in the classroom to provide distance learning, I would like that to be an option for teachers, because one of the things that I heard loud and clear during, distance learning 1.0, I guess we're calling it, is the teachers who themselves had children at home who were essentially, in the next room online with their teacher. And so if we said teachers had to go into the classroom to provide distance learning, then that adds to the number of children that are potentially unsupervised. And so I just would like that to be an option. I don't really want to mandate that. And I really want to thank the CTA, Mr. Katz specifically, about working together to improve the quality of distance learning. I am certain that 2.0 will be so much better than 1.0, right? And it is it's gratifying to hear Mr. Katz, CTA, and the teachers generally saying yes like we want to improve how this was done, and we have ideas. So I think that's fabulous. And then the last comment at this point in time is, yes, I really I want children in the classroom with the teacher. I know that is the best educational structure, but to the comment about the learning to read online, there actually are some programs that are kind of good. Now, I'm not saying better than the classroom teacher, so don't misquote me on that. But I know Kevin McCormick can share some of those because of reading struggles that I've witnessed, had to play with them, and so some of them are decent. Nowhere near the quality of a classroom teacher, though. And so I will come back later with the rest of my comments. Thank you.
Mrs. McQuinn?
Oh, great. I thought there was someone before me. First, let me please, I haven't done this in a while, express my appreciation to all of the staff members and teachers and principals and CTA who have worked through so many of these issues. So I do so appreciate you, as I know all of us do. I'm going to start back with Mr. Shaw's comments. It is the most I've ever heard Mr. Shaw say, and I actually agree with every single thing he said. I got most of them written down, and I know Dr. Fenoy will have his staff go back through all of our comments, so I don't even think I have to commit those to memory. Let me first start, though, with, and Dr. Robinson referenced it, and kind of Mrs. Andrews, in terms of teachers being physically in the classrooms. Certainly, we have health issues that have to be addressed. Putting that part aside, that has to be however we do it in our HR department. Certainly, we deal with that. But just in general, our adults will work better. Teachers learn best from teachers. And so if they can be in small, safe groups, they know how to abide by CDC guidelines. And they're going, if they have their classroom equipment there, they're going to be able to get into it more readily. So I wholeheartedly support, I hope I don't get a million emails from this, because you know I care about teachers a whole lot. If we don't have teachers, we can't teach kids. But I would like to see them go back into the school building, and I think that will bring them a greater level of comfort when they finally do. And I certainly would expect that we be listening, we meaning Dr. Fenoy and his staff, be listening to what the teachers are encountering, and that they not feel, it's like the kids, sometimes they don't want to admit they don't know something. A couple of teachers I talked to today and said, I don't know how to do this, and they want to know. So I just feel like they'll do better if they can be in the building, unless they have medical conditions that would not allow that. The other piece, Dr. Fenoy, with perhaps starting later with the kindergarten to second grade, my only issue with that is that then we have equity among teacher levels. You're expecting me to be in front of kids now, but the teachers of other grade levels are not. And that certainly has to be something that is worked on. Wait a minute, please, for just 1 second, because I know, I'm sorry. Overwhelmingly, the teachers who sent all of us emails pleading to be allowed to do the distance learning. Notice I didn't say from home. To do the distance learning. And many of us saw it, but it really struck a chord with me, and the teacher put in all caps, and she said, "You teach me how to do this, and teach I will." And I really believe that they will do that. Thank you. Oh, by the way, clearly I think we have to start with distance learning.
Thank you, Ms. McQuinn. Mrs. Whitfield?
Thank you. Well, I figured and now is a good time for me to share my thoughts. So I will jump in with those kind of where I've come to. So I wanted to first say that I know I've been the most reticent to do distance learning. I have struggled with this a ton. And the reason why I struggle is because I I watched my daughter do this for 2.5 months, and it was super hard to motivate her to get up and get on the computer every day and watch her slowly losing interest in her favorite thing, which is school, is really hard to watch. So I have to say that it's been a real struggle for me. I remain concerned. I think that there's a lot to this story. I think that when we talk about keeping kids out of school, we're taking them away from people that really care about them, who act like they're surrogate parents, who watch out for them, and if they have child abuse that is happening at home, they're watching them, who are feeding them many meals a day, as you hear me say multiple times, who are checking them for mental health issues, who are making sure that they are being cared for. Also, it has a huge impact on the economy in our community. So that's another struggle that I have. One of the things that I did in trying to learn about this situation and trying to come to my decisions on this was to talk to doctors and other public health professionals that I really, really appreciate and respect, to get, the best ideas that I could, and try to understand if it was even possible for us to go back. I also got some numbers in our county on how domestic violence has gone up in the last year in the time we were off, and how child abuse has gone up. Mental health calls to 211 went up, but then actually did stabilize. So I got that information as well. So I say all this to say that there's a large story here. But even with all of that, I've finally come to the place where I realize that there's just not a good way for us to go back. And I want to more than anything. So I feel like the only way that I can be comfortable with us starting in distance learning, and I would love us to start on August 10th if we can. If teachers need more time to learn virtual and be really good at it, I'd be fine with that. We could start another week later if we have to do that. But I do love what Mr. Shaw said about a timeline and what a few members have mentioned about metrics. I want to know, what does it take to open these schools back up again? I've heard from many public health professionals, and one of my favorite doctors said we need to have opportunities for treatment that's really successful so people aren't dying. That really resonated with me, and that we need to see the numbers consistently going down. I'm curious what that means, and I know that this staff doesn't necessarily have these numbers right now, but I want to see, like, when you say numbers going down to what? Like, down to where? What point are we looking for? When is it okay? Because, and I like the idea that Mr. Shaw said about a timeline to actually revisit at a specific points, because I think that our families in this community really need to know, what they can plan for. And right now, the unending distance learning is like terrifying. And I know we don't have all the answers, but to the best of our ability, if we can say, if our numbers come down to, this, or if we're seeing a negative, increase or whatever over time, then that would be an acceptable thing. So that's one of the things that I'm very worried about. The final thing I wanted to mention is that when I talk to a lot of my friends who, like me, had very difficult times with distance learning, a lot of them have talked about hiring tutors for their children, private tutors. And to me, that seems wonderful for them, but completely unfair for all the children who can't afford that. Or who don't have a family member or parent who can assist them with their schooling. So I'm curious, and I mentioned this to Dr. Sheffield the other day, if we can have an ability for us to pay our teachers to spend one-on-one time with our students, if they're not being successful in distance learning, really recognizing that early on before we wait for grades to come out and we find out which children are really struggling the most, how can we try to head that off? And I know that our staff is really working hard on this, but I think that we need to really think outside the box if it's going to be this online time. I think these children need some one-on-one time with their teachers, or with a teacher who can really walk them through some areas that they're struggling with. Because I think the implications of being in distance learning for as long as we're going to do it are going to reverberate in this community for a long time. And so, anything we can do to try to mitigate that up front, I think, is really important. Thank you.
Ms. Brill.
Thank you. So I want to start off by thanking my colleagues for sharing their thoughts. I'm going to move around with a few things, but first I'll start with Mrs. Whitfield. If I'm right, and legal can weigh in afterwards, I do not believe that we can pay teachers in addition to their salary to work as tutors with the students. I just vaguely remember something about that being a problem, and I'll let our general counsel answer in a minute. I see that she's there, very alert. But I just want to thank Mrs. Andrews for her comments about keeping our employees. That has been, for me, the biggest part of my angst. It's their salaries and it's their benefits. If we aren't able to keep them all on payroll, I just have these visions. I just want to make sure they have health care at the very least. But best of all would be to be able to pay them, then that we can open up during that period while we are paying them. To Mr. Shaw, a lot of people now have commented about teachers being in the classroom to teach. I did speak to Dr. Fenoy, I think about a month ago, about the option for teaching from the classroom. But I agree with Dr. Robinson. I have teachers in my district who are unable to be around other adults right now. So I would rather it be voluntary, but the more important piece is that teachers have access to their classrooms. And the reason I'm saying that is some of my neighbors have told me that, I don't know if any of you watch Guys Grocery Games where they take a shopping cart and they run around and grab things off the shelf. Some of them were given 15 minutes in their classroom on 2 different occasions, and they had to run in and literally grab whatever they could. I'd like teachers to have access to their classrooms and, if they so desire, to be able to teach from their classrooms. So I don't know that I want to make it mandatory. I think that the union should definitely weigh in on that piece. But I think them having access would be terrific. And finally, before Ms. Rico answers about paying the teachers to tutor, I think it's very loud and clear what this board is saying. I know, Mr. Barbieri, we haven't heard from you yet, but I think it's very loud and clear that we are talking about going distance learning 100% on August 10th. So by the conclusion of this meeting, even though we cannot vote, if we can put some type of information out, or hopefully the public is listening, because that's what people want to really know is, what are we doing on August 10th? We can fine tune it. We can come up with the metrics and do everything else. But people really have to know, and working people need to know what they need to plan. I have not gotten a lot of pushback because people see the numbers rising. The only question that I am getting from people is, how soon can we go back to brick and mortar? What will those metrics look like? We will work with you on the distance learning, but let's be able to look down the road as best we can. So that's my comment.
Thank you, Ms. Brill. I'll take my turn before I start calling everybody that's already on the list.
Can Ms. Rico just answer the question? Sorry, Mr. Barbieri.
No problem. Ms. Rico?
Sure. Thank you so much. So there have been a lot of legal issues posed today. Mrs. Brill, yours not being different insofar as there's not super clear answers. Our job obviously is to keep the plan and as everything we do in compliance, but we are also working really hard to take more than the black and white letter to try to realize and effectuate how we can implement the plan that is desired to go forward. So with respect to tutoring, yes, there are some limitations about parents hiring teachers and whether or not the school district can hire teachers to tutor afterwards would probably get into a bargaining issue. So I haven't looked at that particular aspect, Mrs. Brill, but I can tell you that those issues, are on our radar screen, and we'll do everything possible to identify those issues that are prohibitive or seemingly prohibitive, and then really help the district support requests for waivers, attorney general opinions, et cetera, whatever is needed. And likewise, while I've got the microphone here, the same goes to Dr. Robinson's question about the forward pay or the payment. We are addressing Dr. Robinson's question. She had asked it before. We are, as Mr. Burke said, we are working closely with them to see, because the black and white statute is in and of itself, by itself, without the implementation, without the putting the meat on the bones, could give us a different result. It's the implementation and how we're going to structure our numerous employees and their different functionalities. So we are actively working on this. I don't want you to think that any of these questions are, in a pile for later. They are on the top of mind, and we're working really hard to seek solutions, and we'll keep you timely advised.
Mr. Barbieri, we can't hear you.
Mr. Barbieri, we can't hear you, sir.
Let's try this again. Maybe y'all don't want to hear me. That's okay too. I want to kind of side where Mrs. Whitfield was at. My biggest concern, and I'm still concerned, and I'm sure that Dr. Sheffield and Mr. Oswald are tired of hearing from me every single day, talking to them about the distance learning, especially with respect to children that I know won't do well with distance learning. For example, at Sunrise Park Elementary School, we have the migrant camp, and there's migrant children there. And, and that school started a camp, which I'm very proud that I helped get started some years ago, where we bring those little ones in every summer. And a lot of them don't speak English well. They have parents at home that don't speak English. And we were able to make a big difference in those children's lives. And I'm extremely concerned that we're going to have a bunch of children out there that are going to be collateral damage to this situation. I told the superintendent, I'm not voting for any kind of distance learning unless I'm absolutely sure that every child out there, especially those children, the ones from the most impoverished families that don't have somebody that can help them, that maybe not have parents that are educated enough to even understand how to teach them or help them get on the computers. I want to make sure that those children have a fighting chance of getting the education they need this year. And I'm scared to death that we're going to fail those kids. And our job, and Dr. Robinson always says it best. It's not what's equal; it's what's equitable. And those kids, we always talk about giving them the resources, the extra resources they need to give them the education they need. And I don't know how we do that with distance learning. I know we can't bring those children back into our classrooms right now. I know that. I see the rise in the infection rate. I said I wanted to base my decision on medical professionals that, and the head of the health department here has told the superintendent that there's no way she would recommend that we reopen the schools at this point with the spike in the virus and still in a phase 1 situation. So I just want to have assurances from the administration that if we start with distance learning, that we make sure that we catch every one of those children. I don't want to miss any of those children. I understand some kids are going to sign on and then not come back because they just don't want to come back. We have to go find them. But I'm talking about the little ones that we don't get initially. And so if we have to postpone the beginning of school until August 17th or August 24th or whatever it's going to take, that's why I wanted all the teachers to have the roster. I want every teacher to know who's in their group so that the teachers, I always say she, I know we have some great guy teachers out there too, but I want that teacher to be able to contact those kids and make sure that there's somebody there that can help them get online. Because, we always talk about 3rd grade reading and how kindergarten, 1st grade, 2nd grade builds into that. We need to make sure those kids are there. I mean, we need to make sure somebody's helping them. I'm scared to death about the kids out in Mrs. Andrews' area. I mean, I've been to those schools, and those kids, they function very well in a classroom. I don't know what they're going to do when they're home by themselves without parents that can help them. So, I will agree that, at this point in time, it doesn't make sense for us to start trying to bring people back in the classroom. I hear it. I know that's going to disappoint a lot of parents. I get it. I look at the emails that we get. It's like I won't send my kids back to school unless they wear a mask. I won't send my kid back to school unless he doesn't have to wear a mask. I won't send my kid back to school until there's a vaccine. Teachers saying, I'm 68 years old, I'm not coming back. You know, it's like all over the place, and I get it. I get it that there's no way. I told the superintendent, this is the first time that this board will ever make a decision in the 12 years I've been here that at least 50% of the people are not going to be happy with it. And in this case, we are not going to make 50% of the people happy. And we're not here to make people happy. We're here to do what's best interest of children. And I just want to make sure that we're doing that when our mission statement says that we're giving them a world-class education in an equitable and excellent manner. And that's what I'm most concerned about. So, you know, I've said what I want to say. I will support the superintendent as long as whatever recommendation he comes with next week, as long as I'm assured that we're going to catch every one of those children, especially the ones that need us the most to catch them. There's other people on the list that wanted to speak, Mr. Shaw, Ms. Andrews, and then Dr. Robinson.
Thank you. Going back, I think when I made my comments, I made it clear that if we invite teachers back to the classroom, that we also have to make some accommodations for those who can't do it. So just so that was, because that is an issue, and childcare is going to be a major issue with a lot of those teachers. You know, it's my understanding, and this is for the superintendent or Mr. Burke, my understanding is that the CDC is going to issue new guidelines sometime between right now and next week. Have y'all had any discussion on whether or not recommendations would change based upon what CDC does? Or I can't imagine it being significant, but how will you react to that if CDC recommendations come out and it's something that really has to impact us? Will we delay our decision next week or what?
Mr. Shaw, right now, I actually literally just saw that while we were listening to the comments. It came on the news. So the answer is we haven't seen them yet, so I can't respond to something we haven't read. I also would say that whatever information comes down, the biggest thing you have to remember, we're still in phase 1. So whatever the recommendations are, still, you know, we're in phase 1. So we would take it into consideration as we start planning the future. If that's the will of the board, but as of right now, Mr. Shaw, until we see it, I don't know how we would react to it.
Okay. All right. Just my final comment, probably nothing else for the day, but it's unfortunate that we're in a position where politics is driving this a lot more than public health issues. And I think it puts us in a difficult position. And I give the board credit because we have tried to, as best we can, stay out of the politics of this thing.
I don't know if, Mr. Shaw, I don't know if I got a delay or you're still talking, but your microphone's off if you're talking.
No, I think my comments, I think you got them all. Yeah, I saw a couple of head shake, yes.
Okay, the next on the list is Mrs. Andrews.
And thank you, and I just want to be really clear that I'm sticking with not sending anybody back into the buildings. We just can't do it. Nothing's going to happen to change my mind over the next few days and weeks, and we're not ready. But one of the things I wanted to say is I wanted to thank the Classroom Teachers Association for being a leader and working with the teachers, as well as the SEIU, the Principals Association, the Staff Association, everybody that's been working together to help the team get everything in order. But one of the questions I get all the time from the community, I speak with the Education Advisory Committee, the elected officials, they want to know, what can we do? Where are you all? What can we do? And they all know the situation that we're in this pandemic, but they want to help. So over these next weeks and months before we can get back to this new normal that we're getting to, we need to continue to communicate. I appreciate all the speakers today. We had some speakers today that went on and on because they had their heart and soul into what they were saying. And we all are on the same page in the sense that we want to keep everybody safe. We want to get you back to school, and we want to make sure that we do the right thing. I'm concerned we cannot allow any child or any adult or anybody to get sick or die or carry this to somebody else to get hurt. And I want to say to legal right now is I asked this question to the superintendent as well as the team, his team the other day about a policy. Because, you know, when we get back, this is still not going to be over with probably when we finally try to phase in. And if a teacher or a student gets sick or something happens, we need to have some type of policy. And I want teachers and staff, not just teachers and staff, bus drivers, custodians. If somebody gets sick in our preview of trying to do what we're doing, I want there to be some type of policy out there, a child, that the school district is committed to making sure that we have something in place to let them know there's a place to turn. And I'm sure you're probably working with the union, but it's bigger than just a union agreement. It's about somebody's life when they say they're going to go back and do this. We have principals sitting in these buildings right now and custodians and all the people. And we've lost a custodian, and I don't know who else is sick. But we've got to get some policies in place that we're going to protect them, so that when we finally do get back in full new normal, trying to get back into the building, some kind of blended model for children and adults, we need to make sure people know when they step in that door that there's some policy in place that's going to help them. But we surely don't want to make anybody go anywhere in any of these buildings in Palm Beach County anytime soon when we're at historic rates of infests of the COVID-19, killing people all over the world. We won't do that here in Palm Beach County. I won't do that. And whatever comes back next week, I'm clear here today to tell you that I will never do that. And I'm hoping my colleagues, as I hear you, you make me feel better, that you won't do it either. Thank you.
Dr. Robbins, do you want to go last? I got one more comment. Can I go first?
Sure.
So one thing that I forgot to mention, Mrs. Andrews, can you cut your mic for me? Get feedback, please. Thanks. So one thing that I wanted to comment on is I had several conversations with Justin Katz, and I also want to thank him. He's indicated that, and I've talked to teachers, several of them live in my street, and they walk at night and they stop in front of my house, and I'm always in the yard working, so they talk, and they want to go back to their classrooms because they said that's where they have their stuff. They don't want to go back to their classrooms to teach kids in their classrooms. They just want to go back to their classroom. So one of the things that that I can see that you can't because you're not here in where I am is there's a camera that's on that big screen in front of me. I've got one of those what do you call them? These you guys know what they are. The big instructional screens there that look like a great big computer screen. There's a camera on top of that, and they've taken the camera off of that out there because otherwise I'd be looking at you all night like this. And they put it up here on a tripod. It's got a long wire on it. So what I've talked to the superintendent about from day one, and that's why I asked the question earlier to Mr. Burke about making sure that we have all these machines, what the hell were they called? The big board in front of me, big board.
Flat panel.
Monitor.
Flat panel.
Okay. This flat panel screen in front of me, they can, the teachers use these in their classrooms for instructional. That's why we put them in there, right? But if the camera's on the instructional and it's pointed at the teacher, then the kids aren't going to be able to see what he or she's putting on the board. So what I've asked the superintendent to do is look into, and that's why I asked Mike earlier about having one of these in every elementary school and middle school classroom, which he's assured me that that's what they're working toward at the beginning of school, is that camera can be taken off of that screen and put up there on the ceiling so that the kids at home can see that teacher. And the teacher can teach from his or her classroom. And one of the things that parents that are most concerned about, I think, a lot of them, other than that they got to go to work and they need a place to have their kids go, is they're concerned with the distance learning. And I think that if we have the children, if we have the teachers in their classroom that are actually teaching the children from the classroom, not only does it help us if eventually we start bringing kids back into the classrooms, if somebody gets sick and we have to start bringing them back out again, if we have that system in place where teachers are teaching from their classroom online and they're being live watched by their kids and the kids are on the screen in front, like all of you are in front of me, and that whole thing is being recorded so that the children have an ability to look at it at home when mom and dad get home from work and might be helping with a lesson or with the weekends. I think that's an excellent, and I want to thank Justin because I know that's difficult. Teachers don't like to be videotaped. I understand some of them, it's not so much being videotaped because they don't think they're good teachers. It's because they're going to get criticized by, the parents out there that, how did you talk to little Johnny like that? You told Johnny to shut up and sit in his seat because he was being, so I get it. But Justin is going out on a limb to assure us that, the teachers will cooperate with us. And I know that the distance learning that we're going to put in place 2.0 is a heck of a lot better than 1.0. And I told them, one of my grandchildren, I'm not going to mention which one, the teacher for that grandchild came on once a week, and that grandchild didn't get much out of that class. So I just want to make sure that we do our job and we teach these kids to our best ability. And I think I've said all I want to say. Dr. Robinson, it's all yours. Our resident physician, take over.
Okay, you're trying to trigger me, I can tell. Okay, I am thankful for all the parents, teachers, community members, and students that have reached out in whatever form or fashion to express their opinions. I told you last week about my Zoom meeting getting maxed out, and then last night we had a virtual town hall, the Coalition for Black Student Achievement, National Coalition for 100 Black Women, both West Palm Beach and South County chapters, as well as Unify. That was just outstanding. I especially want to thank Dr. Osiemi, an infectious disease physician, for taking the time to share his expertise with the 500 plus viewers. We received more than 1,200 comments in the chat box during the 1 hour meeting, and those comments, once they get extracted, will be shared with the board and district leadership. You should have already received the 250 plus questions, concerns, and suggestions that were submitted prior to the town hall meeting. And I think you can watch the town hall on the Coalition for Black Student Achievement Facebook page. So I'm sorry to say I told you so. I wish I had been wrong. I've been a physician for 39 years. I know y'all think I'm old. I'm really not. I've just been a doctor for 39 years. Okay, so we're in a very, very dangerous health situation, and it's getting worse and worse. I'm thankful to hear that it seems that we all see that now. Now, hopefully there'll be a decline in new infections in a month or so. Hopefully. I'm going to add prayerfully. But now there is no way that we could talk about opening face-to-face. The viral load is way too high, as has been said. But I just want to compare, because there's been a lot of misinformation and maybe misunderstanding out there. So I just want to compare a little bit. So let's compare to the last pandemic in the United States. From April 2009 to April 2010, according to the CDC, there were 60.8 million cases of the H1N1 flu in the United States, and a little over 12,000 deaths. Now, that was in a year. In the United States, in 6 months, we've had 134,000 deaths from SARS-CoV-2. Okay? So I just need you to grasp that, right? And I was scared of H1N1. Made me change my entire practice. I stopped shaking hands. I stopped even fist bumping. But anyway, so I would really like to open school. Really, really would. I appreciate the important role of school in the short term and the long term. I'll say maybe this crisis will make each of us more appreciative of the numerous positive roles that schools and their staffs play. But it's not safe now, not in Palm Beach County. Now, I've actually spent a lot of time trying to put together an argument to safely reopen school. That kind of stopped a few weeks ago. But I was pushing for opening with multiple layers of mitigation in a hybrid fashion. That was then, this is now, it just falls flat. But I'll dust off all that when the numbers start going down and it looks like we can see the light at the end of the tunnel where we might be able to safely return to school with multiple layers of mitigation. Now, it has been mentioned time and time again, the opinion statement from the American Academy of Pediatrics, which was well thought out, even if it contained no reference studies, which bugs me. But I want you to know it included the following statement, quote, "It is critically important to develop strategies that can be revised and adapted depending on the level of virus transmission in the school and throughout the community, and done with close communication with state and or local public health authorities, and recognizing the differences between school districts, including urban, suburban, and rural. So I'm glad that we are actually following that advice. So it seems to me also that some people want to believe that a low risk of children getting and transmitting the infection, which appears to be true, a low risk is not zero risk. So the problem is if it's your child, your teacher, your mom that gets COVID, that's 100%. That's no longer low risk, right? If it's you, it's 100%. So as one speaker said, not one life is expendable. And now there's evidence that people, including children, again, we're waiting for science to prove this, but there is evidence to suggest that even asymptomatic infections may cause significant lung damage from the inflammation. Now, so we're talking about children who might be asymptomatic or adults asymptomatic that might have long-term consequences from this. So we have to really, as we say in medicine, act in an abundance of caution. And as the retired deputy chief from the Boynton Beach Fire Department said last night in closing our town hall meeting, we must act as firefighters and address life and safety first. And as one of my former patients said, where there is life, there is hope. So we must do everything we can to make sure that there is life. So I know that there's many issues that we must address to make education safe and high quality. But first is safety. It is life. It is hope, right? And as one of my mentors texted me, people talk about preparing students for the future. We must make sure that the students, families, teachers, staff, and community have a future to prepare for. And so I'm glad to hear my fellow board members embracing this concept. So let's open as distance learning and work with our numerous caring community partners to minimize the negative consequences of extending a student's distance learning time. Those issues include, as we know, and some of them have been stated, unsupervised children, the loss of learning, especially for those who've had the most difficulty, right? Food insecurity, unstable household, all the social stressors. But let me put this out there now. One of the things I think that we could do, since we have multiple layers of mental health, psychosocial support, is we can make sure that our behavioral health professionals, our mental health professionals, guidance counselors, school psychologists, and the co-located professionals are reaching out to our students and staff and families. And we need to ensure that our students and families have the contact information for all these people that we employ that can help them address the stresses at this time. And while we are in distance learning, that we can outline all the protocols. Many of them have been mentioned by some of the speakers, some by some of the board members, all the protocols that we will need to put in place to reopen when it's safe enough to reopen. I'm not even going to scare you by telling you when I think we actually go back to regular school. We're going to take this one month at a time? But at some point in the foreseeable future, I hope we can make it to hybrid, but we need to have all those protocols outlined. And in order to do that properly, we need to also make sure we increase the diversity on the reopening task force to make sure that we're including teachers, administrators, and other school-based staff that work in varying environments so that we can make sure that we are trying to address every contingency that we could possibly foresee as we move forward. So I'm thrilled to hear everybody saying distance learning. I mean, as I said last week, let's call the question. Let's tell people, I know y'all gonna wait till next week, but folks just need to know so that they can make plans. So thank you so much.
Thank you, Dr. Robinson. There's no other comments, no other questions, Mr. Superintendent. Do you have anything that you want to close out with on this workshop?
Mr. Chairman, I think we've heard the board loud and clear. We've taken several hours of notes, and I think we're fine. I'm good to move on to the next item.
Thank you, Mr. Superintendent. We need a motion to, let me get back to the right place on my screen, excuse me. We need a motion to adjourn the workshop so we can start the special meeting. Motion by Dr. Robinson, second by Ms. Brill. Any discussion? All in favor? Opposed? Motion carries 7-0. That'll take us to the special meeting with the board clerk